Hello everyone, this is Alraies from SCAI-TV in Atlanta. I'm privileged today to have Dr. Colin Barker. He is an interventional cardiologist at Vanderbilt, and today he presented a late breaker at SCAI-TV. So new therapies coming for HFpEF patients, and one of the suggested therapy is a new innovative device for septostomy. Can you please tell us about it?
So it's really neat. It's a catheter that does an interatrial septectomy without leaving a device behind. So it's a no-implant interatrial shunt, primarily geared or designed to treat people with heart failure with a preserved ejection fraction, which, as you know, for us is a challenge with the lack of medical therapies that's really effective in that group. And so this started out, and I was fortunate enough to be at the ground floor of this with one of our innovation fellows as an idea and his concept. And literally started out as something you would have designed in your garage or at a hardware store, to the point where we did the first preclinical studies and then had the opportunity to do the first in man with the two feasibility studies, Alleviate HF1 and 2. Those studies were done, the first 10 patients I had the privilege of doing in Tbilisi, Georgia. And it was a pretty impressive setup, but we were very strict about patient selection. It required exercise hemodynamics, which none of us do routinely anymore, but is very helpful in identifying that population that would respond to a therapy like this. So with the exercise hemodynamics and the inclusion criteria, we were able to select patients who, with this therapy at 30 days and now out to 6 months, showed not only a significant improvement in their hemodynamics and physiology, but significant improvements in their 6-meter walk, NYHA classification, quality of life with KCCQs, and some biomarker data of significant improvements in their BNPs. So very exciting, but early on, up to now, we've done 33 patients have been treated.
Yeah, and congratulations. What is the procedure entitled? I don't want to say device. Procedure entitled sheath size, access, and so forth.
Okay, great, yeah. So it's a transvenous, it's a 16 French sheath, and then the catheter is 12 French. And so for the procedure, once you've done your transeptal, you've essentially done the procedure. You do your normal transeptal, and it doesn't have to be in any particular geographic location, so even the mid-fossa, transeptal. We use a safari wire now to deliver the catheter. The catheter has a knob that basically opens up to bridge the interatrial septum and then captures it, and then a half second of RF ablation brings basically a 7-millimeter, very reproducible septectomy or tissue sample out, and leaves a nicely healed half-millimeter rim tissue communication between the left atrium and the right atrium.
And in your study, you did hemodynamics pre and post intervention. Did you do it right after the procedure, or also the subsequent follow-up?
Subsequent follow-up. So everyone had it pre-procedural and then 30 days. And then the initial patients also had repeated hemodynamics at 3 months and 6 months. And the response was at 30 days, and it was sustained.
I don't know if that's a correct question or not, but why HFpEF about HalfRef?
Yeah, no, that's something we talk about actually all the time. Phenotypically, the HFpEF patient, and I'm not trying to be a heart failure doctor, but phenotypically, they seem more consistent. HalfRef gets into a whole different set of issues. And one of the issues that you really don't want to treat is somebody also who has concomitant pulmonary disease or pulmonary vascular disease. The HFpEF group, when we identify this high filling pressures, high wedge pressures, are really ideal because they're more uniform. Also, just the lack of, for HFref, there's all kinds of innovations, medical therapy, devices, CRT. HFref, LASIX. I mean, and now some things are coming along, but nothing really well proven yet.
Absolutely. Well, thank you so much, Dr. Barker, for your great work, and congratulations for late breaker. Please watch these videos and other on the SCAI-TV. This is Chadi from SCAI-TV in Atlanta. Thank you so much.
Thank you.